Hello, and welcome to today's webinar, Local Efforts at the Intersection of Health and Housing. I'd like to start by just thanking everybody who's with us for joining us for the next hour or so as we dig into this topic and look forward to learning and sharing together. Want to begin by acknowledging that County Health Rankings and Roadmaps is a program based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. This program is the result of contributions of many colleagues and partners in Wisconsin and across the nation. Want to take a minute to introduce you to our guests and facilitators today. I am joined by my colleague Attica Scott, who is an action learning coach. Welcome, Attica.
Thanks so much, Allie. Hey, folks, I'll be answering your questions in the Q&A box. So any questions you have for our guests, please put them there, and we'll try to get to as many as we can during the Q&A session. Thanks, Allie.
Thanks, Attica. And I was so excited to kick off this webinar that I forgot to introduce myself. I am Allie Havrilla. I'm based in Smithsburg, Maryland, and I'm an action learning coach with County Health Rankings and Roadmaps. I'm also joined today by my colleague, Raquel. Welcome, Raquel. Oh, Raquel, you might be on mute.
Yep, sorry. Hi, everyone. Good afternoon. I'm Raquel, and I'm going to be working the chat box today. So because it's not the default, be sure to select all panelists and all attendees. And I'm looking forward to chatting.
Thanks, Raquel. And to our guests who have joined us, we'd invite you to practice using that chat to all panelists and attendees by sharing where you're located today and perhaps either the role or sector that you represent. So look forward to seeing those chats coming in. Next, I'd like to introduce James, who's behind the scenes helping with some tech stuff.
Hi, Allie, thanks. If you have any technical problems with Zoom, you can instant message me in the chat, and I'll do what I can to help you make sure you have a successful experience.
Thanks, James. Now it's my pleasure to introduce our guests for today. I'm going to start by introducing and welcoming Joy into the space. Welcome, Joy.
Hey, everyone.
And next, I'm going to introduce Mike, and we'll hear more from Joy and Mike later on about the communities that they're representing, but welcome, Mike.
Good afternoon, everyone. Just glad to be here.
Great, and so fun to see all of those chats coming in to all panelists and attendees. Thanks for sharing where you're sitting today and who you're working with. All right, so now we're going to lift up an opportunity to continue the discussion. Immediately following today's session, there will be an interactive discussion group to deepen the learning. These conversations give you the chance to be face-to-face with other webinar attendees and share what you are doing locally, as well as ask questions of other participants. We're pleased to offer these sessions in partnership with Healthy Places by Design, and Joanne Lee is our lead facilitator. So towards the end of our time together today, watch the chat for how you can get connected and join the discussion group. Want to start by lifting up some learning outcomes. So during our time together today, we'll explore the ways in which housing and health intersect and that connection. We'll understand opportunities to leverage partnerships to secure financing for housing construction. And we'll hear from our guests about how they increased and continue to increase access to affordable housing and home ownership options. Important to our work is grounding in health equity. And so I offer this definition on the screen as one way that we define health equity. And within that, when we say that everyone thrives, within that definition, when we say everyone thrives, we mean equity, and specifically health equity. And health equity is the notion that everyone has a fair and just opportunity to be healthy. Advancing health equity requires action. We must remove obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness. It's also important that we must create access to good jobs with fair pay, quality education and housing, safe environments, and quality health care for everyone. So I'd invite you to hold the concept and definition of health equity in your mind as we continue to walk through today's conversation. I want to take a second here. Oh, and actually I think I got ahead of myself. James, I believe you have a quick video to share to introduce how we frame our work at County Health Rankings.
We all have a role to play in health. There are so many factors that influence how long we live and how well we live. Think of all the things that affect our health. Sure, we could all eat better, move more, and make sure we get our annual checkups. But there's more to it than that. The quality of our homes, the safety of our neighborhoods, and our chance at a good education all influence health in the short and long term. But how can we understand how all these things fit together? Meet the County Health Rankings model. The model illustrates a broad vision for health. The model shows us that policies and programs play an important role in influencing the health factors that, in turn, shape a community's health outcomes. That means not just how long we live, but also how well we live. Health is complex. The County Health Rankings model helps us see all the factors that impact health and understand where we can take action so everyone thrives. Visit countyhealthrankings.org to get started.
Thanks, James. Appreciate that. And I think that video summed up our framing of health better than I might have. And now I want to point out that when you hopefully go visit countyhealthrankings.org, we do have a new interactive model that helps you learn about the measures. And within a few clicks, you can see details of any area of the model. And so what this slide is representing is when you go in and explore the physical environment, it carries you over all the way through to the description for housing and transit. You can follow that line on the slide. And we want to offer a poll now, and just curious, as you think about this broad definition of health and working across the health factors, these blue boxes in that middle image on the screen, where do you see your work? And James, let me check in. Have we launched that poll, or could we launch that poll? Great, thank you. And so feel free to select more than one, but just curious, as you sit in community today, where are you working to improve health and equity? Great, see some responses coming in. We'll give it about 10 more seconds, James. I'm going to go ahead and end the polling, and then I'll share the results. And so delighted to see the focus on the social and economic factors, as well as working across the health factors, right? Because these are complex systems that, just as we're going to discuss today, intersect and work together and hopefully complement one another. So today we're focusing on the intersection of health and housing, and look forward to learning with you about the ways in which that you see these different factors intersecting through systems, policies, and programs in your community. And I've stopped sharing the results. If they're still showing on your screen, you might have to click X to close those out. So wanted to provide, sort of at the macro scale, a couple of ways in which you might explore the intersection of health and housing, and wanted to provide some framing that access to safe and affordable housing provides a foundation for good health. Yet half of all rural counties across the country have experienced an increase in severe housing cost burden since the housing crisis of 2006 to 2010. And this is a challenge because when too much of a paycheck goes to paying for rent or mortgage, cost burden can then force people to choose between paying that rent or that mortgage, or for other essentials such as utilities, food, transportation, or medical care. And as the video just showed, those are factors that influence our health. So as housing costs and rent rises, so does the chance of becoming homeless, especially for families with low income and household budgets that are already strained. So again, this is just emphasizing that providing access to safe and affordable housing is a critical part of healthy and equitable communities. And so the resources that are shared on this slide will be shared with you in the resource guide post-webinar. The first, we wanted to lift up the 2019 County Health Rankings Key Findings Report, which specifically looked at housing. Second, we wanted to lift up the opportunity to visit countyhealthrankings.org and explore your county snapshot. And these are a couple of measures specifically within your county snapshot that could be a starting place to explore the intersection of health and housing. And then finally, we wanted to lift up that the National Association of Counties, who are our partners, have an affordable housing toolkit on their website, which might be just another place to go and look at some data and contextualization of this intersection of health and housing. And now that we've provided some framing at the larger scale, I'm going to invite Mike and Joy to join me on camera. And we're going to hear a little bit from them. And as they're coming on to camera, I want to lift up that Mike and Joy were participants in a recent learning cohort in partnership between NACO and County Health Rankings and Roadmaps. So my colleagues Attica, Raquel, and myself have had the opportunity to work with them over several months doing a deep dive learning on rural housing topics. So I'm delighted that they're here today to continue sharing their journey with others, and just again want to say welcome. And we're going to kick it off by just asking you both to describe your community. What does Rice County, Minnesota look like? What are some of the assets that you would lift up and bring into this space today, Joy?
Okay, so I am Joy Watson. I'm the Director of Housing for Rice County, Minnesota. Rice County is directly south of the Twin Cities metropolitan area. So we are just south of the Minneapolis-St. Paul area, and we are about 65,000 people. And we have a pretty good mix of agricultural and manufacturing in our area. And one of the unique things about Rice County is that we have a very large Somali immigrant population. And we also have then, compared to other Section 8 programs around the state of Minnesota, 6 times the state average of households over 10. So that creates our challenges.
Great, thanks. And from Minnesota, we'll head down south to Kentucky. And Mike, I'd welcome you to introduce McCracken County, Kentucky.
Great. Good to see everybody today. And my name is Mike Muscarella. I'm the Executive Director of Ambulatory Services here at Baptist Health in Paducah, which is the county seat for McCracken County. I also chair the Purchase Area Health Connections Regional Health Coalition. It's an 8-county health coalition. And part of that is Healthy Paducah, which is the McCracken County Health Coalition. Like Joy, our county is about 65,000 people. And we are equidistant from St. Louis, between St. Louis and Nashville, Memphis, and Louisville. And we have interesting population because we're a crossroads. So we have a lot of folks that are transitioning into and out of our community throughout the year that we work to try to affect change. Our coalitions are really the keystone for the change agents that we have here in our county.
Thanks, Mike. And so maybe sticking with you, Mike, for a minute, we are talking about this intersection of health and housing, and would just love to hear, when we think about that intersection, how do you describe housing as a social determinant of health?
Well, it is a very large social determinant of health. While preparing for today, I was reading some of the physicians' thoughts about social determinants of health and housing in particular. And when you look at what they look at when they're caring for their patients, they're thinking that patients really want to know more on how to pay for the health care they're getting. And housing is a little lower on their list at about 50% of the physicians thought, this is something that's very important to them. But housing is healthcare. And if we do not facilitate high quality education to lift our youth out of poverty and allow them to have safe housing, that homelessness will continue to replicate itself generation over generation. And I was talking to one of our teachers in our city schools who said to me very poignantly, she says, Mike, homelessness gets in the way of the health of these children. You know, the need of the moment is what's being addressed. It's their food, where they're going to rest their head that night. And again, homelessness is not just on the corner, you know, downtown or at the exits of our interstates. It's couch surfing, and we all are familiar with that. People going from different homes to different homes, different family members. But it's that particular need of the moment that they're attending to. And so everything else kind of takes a second base, so to speak, with, you know, it's an afterthought. Their health, mental, physical, emotional. They just don't have the bandwidth to address those needs because of the overcrowding of that need at the moment. And I asked our director of our housing authority here in Paducah, I said, you know, should we just get more housing? And of course, we've been through the cohort all last year and we talked about housing. And they said, we don't need more public housing, we need market-based housing. So when a person has a job, they can have quality, affordable housing based on the income that they have. So housing is a huge determinant of health, and other things can mask the reality, but if you don't have a good housing, your health is going to decline.
Thanks, Mike, and so much richness in what you shared. And I think, again, speaking to, I heard you lift up education, housing, healthcare, and the connection that exists between all of those systems and how they both create complex challenges, but the opportunity to think about solutions too across the systems.
Right.
Joy, I might ask you what else you would add or share from your perspective.
And so one of the things I wanted to follow up with what Mike had said is more market rate housing. One of the challenges we face in our county and in much of Minnesota is that there is just such high rental costs. So our county, for instance, has the third highest rental market in the state of Minnesota, but we don't have incomes to meet that. So we'll talk later about the amount of residents of our county who are cost burdened. And so if you are spending all your money trying to put a roof over your head, you are having less money to have for healthy food, to buy your medications. People are having to make those choices between, do I pay my rent or do I buy my blood pressure medication? So housing has a real impact on people's health, starting with just the cost factor of that and what percentage of their income goes into it. And we can talk about long-term outcomes of housing on health, and that people who are more stably housed have better health outcomes, better educational outcomes. But having substandard housing has very immediate health impacts as well. So we look at especially older housing stock. You have issues like lead-based paint, and then you're worrying about children having elevated blood levels. Houses that are not in good repair can have leaky roofs, things like that, bad plumbing that cause mold, that cause allergies, that cause respiratory issues for everybody in the family. And so there are just all those ways that housing impacts your healthcare.
Thanks, Joy, and I appreciate you lifting up sort of this tension between immediate outcomes and long-term outcomes. And I think for me that speaks to the blend of the opportunity to take action across policies and programs, right? So what are some programs or strategic steps to create an immediate safe housing or safer house that then lead to or support policy change to support some of those longer-term outcomes? So, and you guys have already started to touch on this both through your introductions and through how you even look at housing and health. But we know that this work takes many and takes partnership and collaboration across community. And so, Joy, why don't you tell us a little bit about the ways in which you're partnering in community?
So for Rice County, one of the solutions that we chose to pursue was Section 8 homeownership. So we administer a Section 8 program, which is low income rental assistance housing. And so part of that, you are allowed to do a homeownership component for your current participants, and you have to do a lot of collaboration to make that work. That's not something any one agency can do to get low-income households into homeownership. So one of our biggest partners is our local CAP agency. They do our homebuyer education. They do credit counseling. They start with families to see if they're credit ready, and if they're not, there are times when they take 2 or 3 years to help a family build that credit up. We're working with lenders, especially because we're still considered a rural county. We work with the USDA Rural Development Home Loan, and they provide subsidized interest to low-income households. We've done a lot of partnerships with Habitat for Humanity. You can have partnerships with other local governments. So if you're a city, maybe a county or the state may have down payment incentives, things like that. And then working with local nonprofits in your area to kind of layer all these things together to get a family into more stable housing.
Thanks, Joy. I appreciate the notion of layering and working together and figuring out the strengths that each group is bringing to the partnership. And Mike, I might ask you to share a little bit about what partnership and collaboration looks like in Paducah.
As we have the Regional Health Coalition, the Purchase Area Health Connections, that is the umbrella over Healthy Paducah, which is our McCracken County Health Coalition. We have many participants in that county coalition, but the keystone is the United Way. The United Way, it's a very non-threatening area. It's a safe place. You don't have to have, it's not one organization or the other, like it could be our hospital or the other local hospital here. And so it really neutralizes all of the possessiveness that some organizations can have, so we can work neutrally and together to advance the issues that we have. So the United Way hosts all of our meetings and helps bring together our housing authority, the community kitchen, which is a nonprofit that feeds about 1,000 folks a day for lunch. But not only that, they have counseling for mental and emotional health. They have what they call navigators that help people who may be homeless find housing, or who do not have insurance get plugged into the insurance, whether it's Medicaid or another product that they can tag into, and work together to help those people at Community Kitchen. So we have brought those folks in. And then we had a meeting to address homelessness specifically before our cohort with county health rankings and roadmaps. And we brought the mayor, the county judge executive, and our large coalition has applied for HRSA grants to address people transitioning from the hospital back home. And that includes folks that are homeless and trying to find ways that we can use community health workers to make that transition much better. And what our community health workers have done is they have really addressed the social determinants of health, such as housing, being able to get their medications, food insecurity, and allow the patient to recover in home or in a shelter, to allow them not to get readmitted to the hospital, which is very taxing on a person to do things like that. So we see that blend of collaboration. And the other thing is the reality of knowing that we have over 200 children just in our city schools that are homeless, and that is very that's very traumatizing for these students who are trying to learn, fortunately, we're able to work with them and identify them and start collaborating with the schools to address their needs. So those are the partnerships that we have utilized among other nonprofits. We have so many that we all come together in the coalition and can work in a way moving in the same direction to address this issue.
Thanks, Mike. And I appreciate that you lifted up working with elected officials. I think that's such a key part in figuring out the ways in which that you can work together to support one another in these efforts, and especially at the intersection of housing and health. I do want to take a minute and just briefly lift up a County Health Rankings and Roadmaps resource for folks if they're interested in digging deeper into partnerships and exploring possible ways to partner or potentially become a partner in efforts around health and improving health and equity. And we have a partner center within our website, and Raquel is sharing out a link that you might save and take a peek at later on after this webinar. And so now I just wanted to hear a little bit from both of you about what some of the unique community challenges that brought you to focus on this intersection of health and housing, and really creating safe, accessible, affordable housing for your community. And so, Mike, I might start by asking you to bring forward some of those challenges that led you to focus on this issue.
Certainly, Allie, thank you. One of our big problems that I mentioned early on is that we have a lot of people that are transitioning into and out of our community. And so we're trying to provide just-in-time services for individuals, and most of the time it's families. And one of the things we have realized that the challenges that we're facing is we do not have enough temporary housing for families. And that's really a big area that we're working on trying to address. And it's not long-term, just short-term, as these people are moving through and trying to get to a more secure environment that may be, miles away, in other communities and in other states. Also, the workforce housing needs to be a stepping stone and not an anchor. I was talking to our director of our housing authority, and on their wall, outside their office building, it says the Housing Authority of Paducah, move in, move up, move ahead. The problem is people move in and then stop. And that creates a huge bottleneck, because we'll get folks that are between the ages of 18 and 50, they move in, but complacency gives them that level of housing security, but not the opportunity to move up if they don't pursue other things like their education, job opportunities. So they become complacent. And then the people that really need the housing can't get in. We've got over 800 units, and we have a waiting list of over 400 families. And a lot of those people in the units now could possibly work more, get higher paying jobs, and get into better living situations. But they realize, I only need to make this much money to pay this much rent in the housing development, and I can stay here and be just the way I am and comfortable. So I think that's been a big challenge for us. And I did say we have a lack for temporary housing for families, and we do have a problem with unaccompanied homeless youth. They sometimes can fall into the cracks, and you see faith communities or individuals take these people on and become their guardians, and it gets very convoluted and complicated. Can they speak for themselves? Can they get help independently? And there are some laws in each of our states that regulate that and can sometimes hinder us being able to take care of them. However, our school systems are working to try to address that and make sure that all of our youth, especially unaccompanied homeless youth, get the services that they need. And I'll talk about that in a little bit.
Thanks, Mike. And yeah, I just want to lift up, and I know you're going to touch on this, is that it's the opportunity to create supports and access and resources to help move into that stable, secure housing is such an important key as well. And so Joy, might turn to you to lift up some of the conditions in Rice County.
Okay, thank you. So as I talked earlier, we have a very high rental market. So if you look at the chart, this was from our last housing study, and this is from the American Community Survey. If you look at various communities within our county, there are counties where 100% of families in that community are cost burdened, and that means they're paying more than 30% of their income for rent, which is considered an affordable amount to pay. And so if you also look at that chart, what is considered affordable, as I mentioned, we have the third highest rental market in the state. And so we have people that are working in a lot of manufacturing jobs, a lot of what are now, we talk about essential jobs, so working in Walmart, PCAs, things like that. And so it is just incredibly difficult for families, even when they are working a full-time job, to be able to afford somewhere to live on even 2 salaries. And then overcrowding, that's another big issue. As I mentioned, we have 6 times the state average of households over 10. And when you have that situation, you have to think about availability of housing in any of your communities. There is very little even single family housing that is built to accommodate a family that large. And as family size increases, usually the quality of the unit increases, and that's when we start seeing things like kids having elevated blood levels because the home that they are living in is old and has never been updated or anything to remediate that lead. So families are living in crowded situations. And one of that really became apparent with COVID-19, because you see how living situation impacts a family. I have a coworker who is a family of 6. She's got 4 children. She had her 2 college-age children both get COVID. And because of their house, they live in the typical suburban split-level house, plenty of bedrooms, family room in the basement. Those 2 kids were easily able to self-isolate in the basement. Somebody would bring their food down, leave it, they would come out and get it. And so the other 4 people in that house were not infected. And so they got through that relatively easily. In our Somali community, Rice County ended up for several weeks as one of the highest positivity rates in the country, because we have these large families, they're living in crowded situations, and they're also working in essential jobs. So they're working in food production, they're working at the grocery store, they're working at Walmart. So when you have one person who's going out and working and then coming home, and you're working and living with 10 or 12 or 14 people, one person now becomes an infection of everybody in the family, because they are essential workers. When they're lower income people, they are not generally people who have the privilege of sheltering in place. They have to go to work. They don't have the opportunity to self-isolate within their homes. And so we saw in a very real time frame how quickly someone's housing situation can impact their health.
Thanks, Joy, for sharing that very real-time, relevant example of how some of the conditions are being amplified through COVID. You had lifted up earlier on that one of your strategies was to move folks from rental to ownership. And so I'm wondering if we could take a minute and walk through that and share a little bit of an example of how that is a benefit.
Mm-hmm. So one of the things we decided to pursue was the voluntary home ownership option within Section 8, which allows you to take existing funding that you have. So if you have a Section 8 voucher, you can just transition that to a home ownership voucher. And with that, rather than using your budget for that particular family to pay rental assistance, the family will go out and get their own mortgage, and you help them pay the bank instead each month. And before they get to that point, they've gone through, as I mentioned, the credit counseling, the home ownership classes, all of that. So we really work with our local CAP agency to make sure that families are prepared for this. And so I have an example here, and this is all relative to your local community. So every community in the country that has a housing authority has income limits for how families qualify, and then also payment standards that spell out how much you can spend for each bedroom size. So this is all relative and would be adjusted based on your local community. And also the purchase price of the house. For here, $212,000 is a very average house. Depending on where you're from, that may seem like a lot. It might seem like a very cheap house. So, but that it's all relative to your local market. But for this particular family, they were a family of 9. They were living in a rental house that was 4 bedrooms. They could have qualified for 5. Just keep that in mind as we go through, but they qualified for, or they had a 4-bedroom rental. The monthly rental cost of that was $1,519 based on the family's income, household size, things like that. We as the housing authority were paying $450 a month in assistance. When they bought a house, they did buy 5 bedrooms, so it was more appropriately sized for their household. And their monthly mortgage payment, when we layered in things like down payment assistance through the state, the Rural Development Home Loan Program, all of that, they were paying $1,075, and we were paying $514, which we would have paid more than that if they had had a 5-bedroom rental. But basically, it costs you the same amount of money to house a family in a permanent situation. And this particular family decided to buy a house because their landlord refused to fix their heat when it quit in the middle of winter in Minnesota. And so he had gone to Walmart and gotten them some space heaters and absolutely refused to fix it when we told him to, refused to fix it when the city rental licensing office told him to the point that the city had to actually take him to court. He was found in contempt, lost his rental license and all of that. And so the family, I will say, was reluctant at first because when you're a low income household and you don't know anybody that has ever owned a house, that's pretty scary. That's not something a lot of the families that do this, they never dreamed that this was something that they could do. This family got into the home and now really they're one of the best advertisements for us because I see the dad occasionally and he tells me that he tells everybody at his job that they need to buy a house too.
Great, thanks for sharing that. And I love the ending on the optimism and hope and the positive of how the story turned out. Just real quick, Joy, wanted to check in. This is, I think, some of what you just walked through, but see if there's anything else you wanted to add here.
I did get ahead of myself a little bit, but basically how it works is the family has to go through the education. They have to get their own mortgage, just like they would have to get their own lease if they were doing rental assistance. They get their financing and do their home search. And usually for us, the CAP agency is who helps them. The home buyer counselor helps them find a realtor, pick a bank. And I have a typo on here. It says we're not party to the lease, but we're not party to the mortgage. But for a housing authority, really, it's no different than rental assistance. And if you can spend the exact same amount of money from the exact same funding source and have a much better outcome, why would you not do that? So I really encourage those of you that are from a housing authority to really consider that. And then there also is an additional one-time extra administration fee that you get for the time that you did spend doing that. So really, it's a great, great program.
Thanks, Joy. I just wanted to take a second weaving together the story and examples that you've shared today, pulling forward, and I'll let you just lift these up, some of the benefits that you've shared, both in normal times and perhaps as have been demonstrated through this time of pandemic.
So one of the benefits is that it does provide stable housing. There's plenty of research that shows that low income families tend to be less stably housed. They are moving more frequently, and those interruptions in living situations can cause kids to fall behind in school, mental health issues, all of that. There's lots of research to show that with this, families can find a house, they can stay there. One of the issues we were running into with larger families is that due to rental licensing restrictions, every time a family had one or two more kids, they were having to move. So, I mean, I've known families that have moved 4 times because they're over occupancy, where if you're buying a house, that's not going to happen. From a housing authority standpoint, you're not spending any more money than you would. So you're allowing families to have a better living environment, a more stable environment. If you are at a housing authority, you can use that in conjunction with your self-sufficiency programs. And then, I mean, the biggest one is that you're helping low-income families to build wealth. And so again, I just looked on online the other day, pulled up one of the families that have bought a house, and we've had almost 20 families now that have done this over the last 3 or 4 years. One of the families, and actually our first family is getting ready to sell their house now, and they bought their house at a lower price. The market was lower. This family now has a house that is worth $90,000 more than it was 3 years ago. And I don't know any other way that you could allow a family with this now family is a single mom who has, I think, 9 kids, who works as a personal care attendant. I mean, there's no other way that could happen for her. And then for COVID, as I had mentioned, I mean, it just really allows families to be able to self-isolate. They're not living in close quarters. They're not living in apartment buildings where even if they try to self-isolate, you still have to use the community laundry, things like that. The mailboxes are in communal areas. So it is a good option for families under any circumstance, but especially with COVID, we're really seeing the health benefits of having those kind of options for families.
Great, thanks. Yeah, I think that nugget around wealth and asset building is such an important beneficial takeaway from your example. And Mike, want to go back to you to hear a little bit more of the work in Paducah around the intersection of food, housing, and mental health.
Yes, it's all intertwined together. Housing, food, and mental health are stitched together to the point where, for example, you have a person that has mental health issues in one of our housing authority locations. People then don't want to be around this person, and that causes even more isolation in view of what we're dealing with SARS-CoV-2. So you have an issue with that mental health issue being exacerbated and putting that person more at risk. We're seeing some of the housing where our folks are able to obtain maybe in food deserts. And we see more of our grocery stores congregating more toward the exits off the interstates so that your local neighborhood grocery stores aren't as local. And you may have these dollar stores that pop up that may have calorie dense but nutrition weak food opportunities. And so we're starting to see some of those folks trying to bring in some fresh fruits and vegetables or farmers markets. But one of the issues that we've seen is that our children can have and develop these mental health issues. And our coalition and the work of our hospital and the work of our behavioral health center have developed school clinics where there's a nurse practitioner to address the physical health of the student at the high school, middle school, elementary school. And then we have mental health workers that can address the mental health, and it's accessible to those children during the day in schools. It's also accessible to their parents, to their family members, to the teachers and the staff and faculty. So I'm very excited about that. It's one of the ways that we're able to make sure we're feeding our people, our students in the morning and at lunch, and we're giving students a snack to take home. So we're trying to give them the nutrition that they need during the week, but we're also trying to address the other needs that they have. And the Health Coalition, along with our nonprofits, has facilitated the use of Charity Tracker to make sure that our nonprofits get a clear understanding when a person comes to them for help, wherever they are at that moment in time. They can see what other resources they have used over a past history so that they don't duplicate things, or if they were given certain items in the past and are asking for the same items now, trying to figure out what their needs are to get them to the right place, whether it's food, whether it's housing, whether it's counseling, whether it's healthcare. You know, our fear right now is that our nonprofits are draining their resources very fast in McCracken County. And we're wondering, of course, cold and flu season's coming up, the winter's coming up, and when will our resources start getting so tight that we won't be able to help as many people as we are now? So that will then exacerbate mental health issues. And I know there was a comment in the question and answer section about, you know, mental health and the current pandemic, and that is exacerbating current mental health issues and allowing people that have never had mental health issues to start developing issues because of the restrictions that we're under. So I think all of that is tied together, and you add on the homeless factor to that, and it just makes it even worse.
Yeah, thanks for that, Mike. And I know in preparing to share today, you lifted up a couple of resources and strategies, and just wanted to see if you wanted to mention any of those here real quick before we give you a break.
Right. Well, I'm excited about this. This is just really some cool stuff. Our local government, Rotary, Kiwanis, nonprofits have developed a community scholars program. Any student that graduates from homeschool, public school, parochial school, private school in McCracken County can attend West Kentucky Community and Technical College free of tuition for 5 consecutive semesters. What an awesome opportunity for our kids. It allows any of our students that graduate with a 2.5 GPA, no major disciplinary action, and a 95% attendance rate to be able to go on to the next level of education free of tuition. We also have what's called the Scholar House for single parents, single women who have children. They can live there free while they're going to the community college to get their degree. They can become a nurse, a physical therapist assistant. They can get prerequisites before they go on to some other career. They can graduate, they'll have a job, and they can move on to the next level of housing. That's exciting. Grace County, which is a county just south of us, excuse me, is exploring utilizing a mobile mental health and telehealth unit in Graves County. And they have a high percentage of Spanish-speaking residents in their county seat. It's 12% in Mayfield, Kentucky. That will be a huge benefit to the population of Graves County, which is highly agricultural and very rural. We're also seeing that because our libraries are such sources of information for every part of our community, but most especially people that are homeless, that now that they've been restricted in their opening and closing, we need to look at smartphone distribution for these folks so they can access some of the web pages that they can apply for resources or help find support in their moment of need and try to get them to move forward. Lastly, we really want to continue to focus on youth. Adults do really, really well, and we try to meet their need. But if we can help get the youth tied into education attainment, keeping them healthy, getting them to the next level of education so they can have career development, they may not fall into the trap of being homeless that binds them and keeps them just with the tyranny of the urgent, addressing the issues at hand. And I forgot to also mention, we need to really work with our landlords. We need to educate the landlords, because if we can help them understand what resources are available to their tenants, the landlords will be paid. It's a win-win situation for the tenant and a win-win for the landlord. So we really need to focus on that. And I was talking to, again, our director of our housing authority and I are really good friends. He goes, Mike, you've gotten all these grants with HRSA for community health workers. And we really need something like that in the housing authority, to have a resident there, a person that is a community health worker that advocates, just goes around and develops these relationships to do wellness checks and help plug them into the right resources for that moment of time to help them move forward. So those are some things that I would say any community could explore and work on to benefit their neighbors.
Thanks, Mike. And I love that you lifted up libraries as a piece of the hub for health in communities. I think they play such an important role in all different ways. So thanks for bringing them into our conversation today. Joy and Mike, I'll give you a break, let you go off camera for just a few minutes while we take a second and share one more County Health Rankings and Roadmaps resource, specifically looking at those that are ready to take action and think about some strategies. And audience, I'm going to turn to you and ask you to find your raise your hand button. And we just want to hear from you if you're familiar with our What Works for Health resource, and perhaps if you know how to find it and access it. See some hands raising, that's really exciting. You can access What Works for Health from the Take Action to Improve Health navigation, and then How to Take Action. And that will take you to our What Works for Health page. And this is a tool to help you find policies and programs that are a good fit for your community's priorities. It's a living resource with over 400 evidence-informed strategies. Each strategy is given an evidence rating to help you decide what's appropriate. And evidence ratings convey the likelihood that a strategy will work based on the best available evidence. Within each strategy for What Works for Health, you'll also find a literature summary that highlights the populations that a strategy can benefit, the outcomes it can achieve, and when possible, information about cost. And one of my favorite features is that as available, there are implementation resources to move from idea to action. Still seeing those hands being raised, which is wonderful. So glad that you all have found this resource, and hope that you're using it. Just want to note also that strategies are given a disparity rating as well, and this helps communities use an equity lens as you're exploring the strategies. So this March, we had some updates to What Works for Health, and so we wanted to just quickly highlight what those updates look like. This is a screenshot and an abbreviated version of our paid family leave entry, and it provides a quick glimpse of what the elements we've outlined look like when you come to explore a strategy. We include a title and a temperature gauge illustrating the evidence rating, and that's that green bar that you see at the top right there. And this indicates that the filled green bar indicates that this strategy is scientifically supported, which is our strongest evidence rating. And then if we go back to the strategy, you can see that we include a description and can then move down through the expected beneficial outcomes. And there's space for just a snippet of the evidence of effectiveness, and this is our literature summary. And if you're on the screen, that would go down further. So in the next panel here, you see the assessment of the impact on disparities, which communities indicate, we've heard from them, they especially appreciate the implementation examples and implementation resources. And throughout the strategies, some may include a community and action story, which offers even more information. So again, what's new? You can look at you can keep track of strategies and save them. You can share strategies that you've selected via email with colleagues, partners, or collaborators. And you can also download and print your strategies. And we just wanted to lift up real quick, here's how you could find a list of strategies tagged with rural housing. So if you went into the keyword search and you plugged in rural housing, that would result in 50 strategies. And as you can see on the left-hand side of the image where it says strategies, you could then filter those 50 by topic or decision maker. So some ways to narrow those 50. And then you can also check the impact on disparities to apply that equity lens. So again, we just wanted to real quick introduce and lift up what works for health. So delighted that so many folks had heard of that resource. And as we get to our final time together here in this hour, do want to take a moment to invite you to provide some feedback. So please share your thoughts regarding today's webinar. Raquel is sharing a link to a brief evaluation in the chat. It would be great if you could click on that link when you see it and complete the evaluation after the webinar. Your feedback matters. We look at it closely and use it to improve our webinars. So thanks in advance for sharing your thoughts with us. I know we're getting real close to the top of the hour. And hoping we can get in one question real quick maybe, but I do want to lift up that we do have an October webinar scheduled focused on building equity into community health networks. We'll explore questions like what exactly is a network and why is equity important to it. Check our website for registrations and we hope to see you there. And Attica, like I said, I know we're getting close to being tight on time, but hoping we can maybe have one question before we transition to the discussion group.
Sure, Allie. I have a question that I think both Joy and Mike could respond to. We've had it a couple of times, and it's really around how can, with quality and secure housing, can you assure that there will be access to safe and clean water with indoor plumbing?
Yeah, this is Mike. You know what? That is a huge issue, and in our town, our water department really has worked well to be able to provide these places the resources needed. However, there are some landlords that once you get the water to the house, they may not make it as safe. You know, we've had pipes that have leaked that have caused ceilings to fall in, but by and large, we have to make sure our landlords are educated. That's the area that I see the greatest need, to make sure they're doing the repairs, making sure that they get the water that is clean. But now when you get out into the county and you're getting wells and you're pumping, that's a whole different complicated issue. But oftentimes, the resources that the public health department has can assist those folks in getting the clean water access that they need. I think Joy may have some other thoughts on that as well.
And I would agree. I mean, to have the landlords understand that, I think is very important. And really a big thing is what your state and local ordinances are. So for example, I live in Minnesota, and so we have very strict water quality regulations. Most cities have some type of rental licensing ordinance that requires that type of thing. I am originally from Montana, and I spent many years there doing adult protection on one of the Indian reservations. And then when you get into those much, much more rural communities, that's not the case, where you do have a lot of people who have maybe they're just hauling their water, things like that. And so it's not as safe or as regulated as it is in some other places. So if that's a concern where you live, that's really something I would encourage you to talk to your unit of local government, whatever that may be, if it's city, if it's a county, if it's a tribal area, to establish some regulations to have those protections, because clean water is the most essential thing. I mean, that is something you can't function or live healthily without. So that's something I would really encourage people to do if they don't have that at their local level.
Thank you so much, and thanks, Allie. We had lots of questions, so maybe folks can join us during the discussion group to get to some of the other questions.
Great, thanks, Attica. I know you're headed over there real soon, and we'll bring those questions to that space and work with Joanne. So as Attica just mentioned, we do want to invite you to further explore the topics and engage in conversation with fellow audience members via the discussion group. Raquel is going to chat out the link now, and when you click the link, you'll complete a few quick registration questions. It asks your name, email, and community, and then you'll receive a link to connect to the session. And so we look forward to seeing you over there. With that, I'm going to say thank you. So appreciate again the hour that you committed to listening, learning, sharing with us, and look forward to seeing you on a future webinar. Take care, everyone.